President Biden makes yet another appeal to Americans to get their COVID-19 boosters and to get behind his plan to tackle the Omicron variant. Today, Biden unveiled new steps to fight the pandemic as we head into the wintertime.
So it doesn't include shutdowns and lockdowns, and he insists that his plan should unite Americans instead. Chris Wynn breaks it down for us.
We entered this winter from a position of strength compared to where America was last winter.
In Washington, D.C., President Joe Biden unveiling his winter plan for fighting COVID-19. Air travelers entering the U.S. must now test negative for COVID within a day of departure, regardless of vaccination status or nationality. The Biden administration also extending a mask requirement for domestic travel on planes, trains, and public transit through the middle of March.
What you do when you travel, you take care, you're prudent. Travel always increases somewhat the risk of getting infected.
The announcement just one day after officials confirmed the first recorded case of the Omicron variant in the United States and California. The White House plans to increase vaccine and booster outreach with a focus on seniors and children.
We're going to launch hundreds of new family vaccination clinics across the country. These sites are going to offer vaccinations for the whole family, one stop.
Private insurers will now be required to reimburse the costs of at-home testing kits, and community sites like health centers and rural clinics will offer free at-home kits for those not covered by private insurance.
The bottom line, this winter, you'll be able to test for free in the comfort of your home and have some peace of mind.
In Washington, I'm Chris Wynn.
A new study found people who've experienced a severe COVID-19 infection and recovered are more than twice as likely to die within a year. News 8's medical reporter Dr. Mary Gillis breaks down that new research for us.
Okay, thanks, Alexis. So people who've been hit hard by a coronavirus infection, meaning those who've required oxygen treatment, were on bed rest, and or unconscious as they held on to life as the virus passed, are 233 times more likely to die of COVID-19 1 year or less after they've fully recovered. This is according to researchers at the University of Florida. Scientists assessed electronic health records of close to 14,000 patients who tested positive for COVID-19. 178 experienced severe symptoms, while 246 had mild or moderate symptoms. Patients were then followed for over 12 months. Scientists found most deaths were associated with some sort of physiological stress associated with an infection. In a statement, lead study author Dr. Arch Manis said, COVID-19 is even more devastating than we thought when only focusing on the initial episode. The downstream risk for the most severe outcome, death, is definitely high enough to hopefully make everyone rethink the impact of COVID-19. Scientists go on to say, in a time when nearly all COVID-19 hospitalizations are preventable, this study points to an important and under-investigated damaging consequences of a COVID-19 infection. Coming up at 6 o'clock, scientists have discovered the root cause of coronavirus-induced lung damage. Reporting from the studio, I'm Wish TV's medical reporter, Dr. Mary Gillis.
Mary, thank you. The NFL has suspended 3 players for violating the league's COVID protocols. Antonio Brown and Mike Edwards play for Tampa Bay. John Franklin III is currently a free agent. The NFL says all 3 misrepresented their vaccination status. Last month, the Tampa Bay Times reported Brown showed a former employee of his a vaccination card he said he had purchased.